Hi, I'm Dr. Bill Harwin. I started my private practice February 23rd, 1984, nearly 38 years ago, and it will be that next month. And I'm still going strong. I have never been burned out. I still love oncology, and I look forward to coming to the office every day. That may make me somewhat unique, but I love what I do, and I'm passionate about taking care of patients with blood diseases and cancer. Well, I was the son of a pediatrician, and when I was a little boy, I used to go on house calls with my dad, and I always had an interest in medicine. But when I went into medical school at Baylor College of Medicine, I did a rotation with two oncologists that were just brilliant clinicians. It was back in the day, really before CAT scans were commonplace, and they could do amazing things with a stethoscope and with their hands. And I just thought it would have such an interesting future. And I would never be bored with what I did, and I thought that was so important. And I've never looked back. When I was doing my internal medicine training, I was heading towards oncology, and it's just been the love of my life, and I've been very lucky to have a job that I love for all these years. I think that something that was terrible that happened in my life that helped me in some ways in being a cancer doctor is that I had a wife who started the practice with me who had breast cancer. And she was diagnosed at age 37, was treated in my offices by one of my partners, although I was really the main doctor most of the time. And unfortunately, she passed away a little over 15 years ago. And although it's been a terrible ordeal for me and our 4 children, I think it's given me some extra compassion, understanding of the wife or husband or significant other of the patient with cancer. So I think maybe I understand things a little bit different. I think compared to the old days, I hug patients more, and I'm more open and friendly, and I really get to know a lot of my patients on a personal level. Well, I'm very passionate about clinical trials, and I've been involved in the start of our research program and almost every facet of our practice from the beginning. Every advance that we see in cancer therapy, literally every single one, comes from a clinical trial. And we see lots of patients that are getting treatments that we participate in the actual clinical trials that led to the FDA approval of that drug, and that's very, very rewarding. But I'm going to do my very best every single day I'm here to get the very best treatment, to make the very best decisions, and I almost always come prepared. I don't just walk into the office. I know if there's a scan that changed for the worse. I know if the disease is progressing, and I plan ahead. And I'm often thinking that if the current treatment someone's on doesn't work, what will I do next? It's important in oncology to be thinking at least one step ahead, so you don't have to try to wing it when you see the patient in the exam room. So I really pride myself on being prepared before I walk into the office each and every clinic day.